Broadcasting from the business capital of the world, this is the Podcast Business News Network.
And welcome back, everybody. There is an amazing clinic located in Arkansas, specifically in the area of Lowell, Arkansas, that is helping people with their mental health. It's almost weird to say mental health. Back in the day, you said that people would look at you like, oh, somebody's got a problem. No, we're taking care of our health. And one way to do that is with ketamine. I'm sure you've heard that term before. What exactly is it? How does it support? They offer that and many IV therapies as well. So we're going to learn a lot today with Justin and Chelsi Musick, who joins us here on the program. Hey, guys, welcome.
Hi, Steve. Thanks for having us.
Good to have you here. And I've heard the word ketamine, know a little bit about it. As I understand it, it started out as a medication for another use, and then it was discovered that it works to help us with our mental health. Am I right with that?
Yes. So ketamine is an old anesthesia drug. So I'm an anesthesia provider. That's kind of how it fell into my lap. So we use it in surgery all the time for pain and induction of surgery. So the mental health aspects of it have come around the last 10 or 20 years, but it's been in anesthesia for the last 60, 70 years.
Wow. So when we talk about it helping with our mental health, specifically, what are some challenges that it can support?
It treats everything basically but schizophrenia. It can help with bipolar, PTSD, depression, anxiety.
Wow.
Yeah, suicidal ideations, all that kind of stuff.
Why don't people talk about it more?
I think there's a stigma around ketamine just because the special K, party drug, horse tranquilizer, some negative connotations come with it. So the idea that we're using it differently and it's working sometimes seems a little weird to people.
Yeah, it's off-label use the way we're giving it at our clinic. A lot of drugs have been, given off-label, and they found like, oh, hey, we have this beneficial side effect that people can benefit from, such as like erectile dysfunction medicine. Like they were given it, and it had something to do with the heart, I think, for the pulmonary hypertension. They're like, oh, well, here's this other side effect, and so then they started giving it for that, and that's kind of how it happened.
Oh, I totally get it. Back in the day, and I still deal with the lowest level of skin cancer, but way back, and I'm talking, it's probably 20 years, 22 years ago, doctor gave me this med. It's a cream. It was for genital warts. So imagine walking into, your pharmacy. It's like, guys, it's not what you think it's for. Okay, just want you to know. And it worked fantastic on basal cell skin cancer to the point where you didn't need to get surgery. Yeah, you got all nasty and crusty for a while, and then it went away. And then the FDA finally approved it for that use. So what we're talking about here, that happens a lot. So I'm wondering with ketamine, can that, and I loosely say this, take the place of, let's say, antidepressants? Somebody's taking, anti-anxiety meds, whatever that may be. Would it help with that?
Yeah, we have a lot of patients that do get off of their meds after they've been into our clinic for some time and have had the results that we're, telling you that you can get from ketamine. Like legally speaking, when we think about like best practice, it is our best practice to say like, we do know that SSRI type medications, that's the standard treatment. So we do need to say like, hey, don't quit that because we do know that is an effective treatment for some people, right? So for instance, there's another type of ketamine called S-ketamine. So we've taken what is essentially ketamine, and we have a drug manufacturer called Janssen, and they've just kind of changed some isomers on the molecule itself and created S-ketamine. They sell it as the drug Spravato. So this is FDA approved now. It's very similar to ketamine. It's done nasally, but that's kind of how that kind of came about with this S-ketamine kind of thing, right?
And I appreciate the disclaimer. Don't get off. Don't
right.
Not take what you're taking.
Right. So that company has the same protocol of like, hey, like we know that SSRIs, that's the standard treatment, the standard patient treatment that we recognize. So if a doctor, if you're going through, a depressive episode and your doctor's like, oh no, quit taking that, let's try this new thing, could be considered, malpractice. So we're not going to recommend that you drop all your other medications
Sure.
and things like that. And that's something you need to work out with your doctor and with yourself, how you're feeling. Like if you're thinking that, oh yeah, I don't need this anymore, the ketamine's doing great. That's a choice that you need to make medically.
But a lot of times with your SSRIs and SNRIs, they stop working over a time frame, or the side effects of them are horrible. The weight gain, the people have tongue issues with it. Like their side effects are horrible from it. The side effects from ketamine are everything happens under this roof. After that, it's your day is normal. Everything is, there's no withdrawal period from it like there is with a lot of mental health medications.
Wow. When you talk about under this roof, what are we talking about in terms of, I don't even want to say side effects, things that you're just
Yeah. Sure. I mean, it is like this is what happens when you administer these drugs, right?
So when patients get ketamine, it's a weird ride. It can be anywhere from like a floaty out of body feeling. It can be colors. It can be lights. It's memories that come back. So the weirdness that happens under this roof is usually very euphoric. Sometimes it can be a little intense for like our PTSD patients and things like that. But
okay.
The ketamine trip, for lack of a better word, can be weird.
Yeah. We call it disassociation. It's a disassociative anesthetic is the term we use.
And it would be short term, I would imagine, right?
Yeah. So it lasts about 45 minutes to an hour.
Oh.
And then
I mean, people take gummies all the time and experience the same thing.
Way longer than that.
Like, yeah, exactly. I'm close to some friends that can't take antidepressants. They've tried. It just doesn't work for them. It makes them even more depressed. So then there's mood stabilizers and all of that. I'm thinking ketamine, they might be a good candidate for it. What would you think?
Yeah, absolutely. What we find, and you go to Janssen's study, they find that only 37% of people get relief from their depressive episodes with the very first SSRI, which is, you can look at that two different ways. 37%, that's a good chunk of the population that we can say, hey, this is very simple, take this pill. And so we're not saying that SSRIs and SNRIs don't have a space in the medical place, right? Sure. But then after that, it's down to like 33% of the people who didn't get it. And then it goes down to like 4. So you're looking at like roughly half the population. If we crunch these numbers out, you're looking at about maybe 54% of people are going to get help from their first 2 SSRIs. After that, you're called what we call treatment resistant depression. So it's just, this happens to my friend all the time. We've got a friend who's, he's a veteran, has PTSD, he has all kinds of troubles. He's trying to get the VA to approve him for ketamine, and they just keep throwing this SSRI and this one and this one. Then they go back to the first one, like, let's just up the dose. Let's just do this. And he's in just this constant cycle of just depressive episodes, it not working. He's not feeling good, all the side effects. But then he comes in and does ketamine, and it's just life changing. He can function every single day without losing it. And, it's incredible. So I would say absolutely that your friends, they would definitely benefit from ketamine.
How often, if it's, antidepressive medication, you're taking it every day, how often would you do a ketamine treatment? I know that everybody's different, but as a baseline.
Usually it's about, so our VA patients we see pretty frequently. That's a whole different kind of level of trauma. So we see them every 2 weeks to a month, usually. The perfect scenario would be about every 3 or 4 months we would see you. So we would do our loading doses of 8, and then we would see you every 3 or 4 months. And so 3 or 4 times a year.
So you kind of have, like with a lot of SSRI medications, like, oh, give it 6 weeks to work or give it this many months to work is kind of what you get when you take those oral antidepressants. So we have what we call a loading phase
there with ketamine. You're going to do 6 treatments as our protocol within 2 weeks. After that, we're going to push you out 2 more weeks, get a 7th, push you out 2 more weeks and give you an 8th. So that's where our 8 treatments come. And that protocol has worked just phenomenally for people. They're, by the 6th one, they're like, oh, I noticed such a massive difference. Their family members are calling us and saying, oh man, you wouldn't believe, I had a whole conversation with this person, and I have maybe said 2 words to them in the past. So your family members will notice a difference first. But that's kind of the process. So then you go to your maintenance phase that Chelsi just described. Every 3 months you're coming into the clinic, which is fantastic. It's 2 hours out of your time every 3 months rather than a pill every single day. And if I forget to take that pill, I go into these massive withdrawals or have these terrible side effects. It's definitely a
Yeah.
game changer.
Yeah, the side effects. I mean, one of them we didn't even identify. It's sexual side effects. So here you are depressed, then you take that, then you're more depressed. So,
Right? Yeah, exactly.
wow. So you said 2 hours in terms of how it's administered. Then you said that I think it was esketamine was a
Mhm.
nasal spray. So is
Yeah.
it mostly IV?
Yeah, with our ketamine that we're giving is IV. We also do the Spravato. So because Spravato is covered by insurance, it's FDA approved. So it's a great insurance option. But because IV ketamine is
I
used off
miss
label.
that. And as soon as you say
Yeah,
that it's covered by insurance, I'm like, oh, well, all right.
yeah,
Please
yeah.
say that. Please say that again.
Yeah, so IV ketamine is not covered by insurance because it's off-label use, right? So,
It's an old
and
drug.
it's just an old drug, so there's not the patents out on it. Any compounding pharmaceutical pick it up, make ketamine, and sell it, right? So there's just not money in it. But if you have a company that did the R&D on it and then produced what we call S-ketamine, like Janssen did, so now they own that drug. Nobody can make that drug, so now they can sell it and make the profit back from the research and development type stuff from it. That's a little bit of how that works.
So now it's on label use for FDA approval. And so insurance will cover it.
Okay, so is esketamine covered by insurance or ketamine in general? It's the S, right?
Yes, ketamine. Yeah, ketamine would be covered by insurance if you were getting surgery because that's what it's been on label use for. But because we're
Right.
using it for a mental health treatment, insurances won't cover it. So it is cash pay for the IV ketamine. But the
Wow.
S-ketamine you do nasally. It's like if you did Flonase for allergies, right? Like that's how you do the S-ketamine. But yeah, you're in here about 2 hours. But same thing with the S-ketamine, the Spravato. You're in here for 2 hours at a time doing that. So you have with ketamine, it's about a 45-minute infusion. And then you have a recovery period because we don't want to just send you loose, while you still might have some disassociation going on. So you kind of recover, get back, and then you have your ride come and pick you up.
So with the esketamine nasal spray, how is that administered? Is it, you give somebody a spray, wait some time, do some more, do some more. How is that? How does that work? We got the IV, understand that.
Yeah, yeah.
So it's every 5 minutes. So
Ah,
the device that they give you, it's 28 milligrams, and they do it twice, and then one nasal, then repeat it 5 minutes, then repeat it in 5 minutes. So it's a total of 56 milligrams or 84 milligrams. So they're very specific with their milligrams versus the IV. We're able to titrate and change to patients' needs.
got it. Got it. So what is in your experience the number of people that have the trippy side effect? Is it everybody? Is it, 60% of people? Any kind of guess?
It's most people.
With
Most people.
IV ketamine, yes. With the nasal ketamine, it's some have it, some don't. It's a little bit lower dose than what we give here. And with the IV ketamine, kind of like Chelsi said, it's titrated. So yeah, not everybody is walking in and say, well, I weigh this much, so I'm getting exactly this much. It's not like this. There's 90-pound girls that are getting IV ketamine at a much larger rate than a 350-pound man in our clinic, just because of the effects. Like there's such thing as too much ketamine. I can't just like throw a bunch of ketamine at you and then hope it sticks, right? If I give you too much, we're not going to get the results that I would get if I had a smaller dose. The baby bear amount, right? Like Goldilocks sort of theory.
Mhm.
Like there's a specific amount that's just for you. So that's with the IV ketamine. It's we're going to start low and work you up to like, oh, we're here, maybe we're a little past, and then we'll bring you back down. And just like, oh, that was the best treatment. You'll notice you're like, oh, that was the best one I've ever had. I felt so good for so long, and so that's how I know. Okay, that's your dose.
Would you say the esketamine is just as effective as the ketamine?
It's a hard comparison. Uh, Bravado, Janssen, the drug maker, they say under their clinical trials, 40%, 7% of the treatment-resistant depression patients are going to have fantastic results, right? With the IV ketamine, because the dosing is so different and there's some other manipulations we can do on administrating, such as like pushes and things like that, that we tend to have better results and we tend to have faster results. With the S-ketamine, it's much more time commitment, right? So your loading dose looks like twice a week for 4 weeks, then once a week for 4 weeks, and then you go into maintenance, which is once every other week. So it's a much bigger time commitment. And a lot of our patients they definitely have to go through the loading before they're going to notice anything. It seems just from the patients we've served, because they're 20 or 30 treatments in, and they're finally like, oh yeah, no, I'm feeling great. This is finally working for me. So the ketamine, because I think it's a bigger dose and we're able to kind of titrate it to the patient's needs, that it happens faster and it seems to get better results. I'd say we're probably like between 80 and 90% effective on the IV ketamine side of it.
Is there a minimum age? Let's say a teenager having some challenges, could they get ketamine?
That's really hard. So safety wise, we give kids ketamine in the ER all the time. So
Sure.
safety wise, it's completely fine. Kids struggling with mental health is a beast. And so we've treated down to 14 years old. We have a lot of protocols that we put in place to make sure that they stay safe when they're always with their parents. There's a big consent. We talk for about an hour, 2 hours before we go through this. We actually have a mental health pediatrician that talks to them beforehand. So there's a lot more clearance level because you're talking about a brain that's not fully developed yet. So the idea of messing with it too much is scary, but then the idea of your child possibly killing themselves is even scarier. So we kind of navigate those risks versus benefit on that.
And you have the same situation with antidepressant too. I mean, that's some of
Right.
they tell you straight out can cause certain ideations and such. Let's pivot from ketamine over to IV therapy, which is something else your clinic offers. I've heard, vitamin therapy and all of that. Tell us about that.
So the ketamine has been our bread and butter for a long time. Like anesthesia wise, that's what I do. But then when we started adding these pieces of it, I really thought we would just be doing like anti-aging or like, dehydration after a bike ride kind of thing. It's actually kind of turned into a ER triage and a chronic illness and a post-COVID situation that it's been really interesting that how that's evolved because it's helping people. Like there are so many people after COVID that have fallen into this gap of I don't feel good and no one can tell me why. And that has been where the vitamins and the ozone has really been a game changer for those people because we're getting our bodies back to baseline instead of putting a Band-Aid on each symptom.
When you talk about anti-aging right away, I was like, what?
That's all the rage right now.
That is. There's a lot of like vitamins that you can give that kind of slow down your what they call the aging process. Something like ALA, they call that one. That's one of the, it's an antioxidant, it's a phenomenal antioxidant, super powerful, but it helps like slow down the aging process. Is what they say, like on a cellular level, because you're flooding your body with the nutrients it needs, right? It's like putting gas in your gas tank. If you're just putting old crappy gas that you got from the back of your shed into your gas tank, body's not going to run properly. But if you're properly, hydrated and you have proper nutrition in your body, you're going to feel great, right? And so, in this day and age, with everyone who's just so busy all the time, it's hard to make good meals. Our food sources are just not what what we used to be. People aren't eating whole foods because we don't have time, right? So, we just don't have nutrient dense foods anymore. For the most part. So you come in here and you're loaded with vitamins and you're loaded with everything that your body really needs. And you're doing it in your veins. So like it's just bioavailability, right? Like every part of your body can absorb what nutrients it needs at any point in time because you're just right into the blood. Versus eating, there's like, for example, I did a blood panel and like my CoQ10 levels are just drastically low. My family has like heart disease and things like that. So when I look at my diet and things like that, I'm surprised. I was like, there's no way. I eat clean for the most part. I mean, we all have things, but for the most part, like I am pretty diligent about what I eat and just how I grew up. We just ate, pretty healthy stuff. So I was really surprised to see my CoQ10 levels low. So then Chelsea's like, let's just buy some and we'll start giving you an injection. And boom, all of a sudden I'm getting these injections and now my CoQ10 levels are back to normal. Which is good for me because of the heart disease thing. That's a big CoQ10 thing.
I'm right there with you. I take CoQ10 only recently, and family of heart issues and all. And my cholesterol came back borderline high. Never had an issue with it, so I'm on a med for that for now. And I thought I felt some joint issues, and they said, "Oh, I take CoQ10 with that." But I just bought it off of Amazon. I assume it's quality, but how do you even know if you're getting something administered by your clinic, you know what it is,
Mhm.
and it's going right into your system. It doesn't have to be absorbed. Where I don't know the number. I often heard that you only get like 60% of what you take orally in terms of a supplement.
Yeah.
Yeah.
And I would say even probably less than that because most people have what we call leaky gut syndrome, where they just can't absorb food very well.
Wow.
And so then you're pouring water in the ocean. It's not mattering.
Wow. Wow.
Absorption issues, gut issues. Gut health is really important. You can't absorb the nutrients you put in your body if your gut's not, in tip-top shape.
I didn't even think of that. I mean, I've heard of leaky gut syndrome and know what it is, but it didn't occur to me that you could be missing nutrients through that. Wow. Amazing.
And that weight loss shot right now that's so big, people just aren't eating. And then like their hair is falling out. Like it's a nutritional deficit.
Right. Exactly. So, what are some of the other things with IV therapy? We talked about the vitamins and anything that we're missing here.
Yeah. So we have NAD and ozone. Those are the two things I am just really big on right now. We have tons of ozone patients. So ozone, we're currently doing autohemotherapy, which is a blood infused ozone. So we're gonna give you a nice bag of fluid so you're nice and hydrated, and then we're gonna like drain some blood out of you into a bag. And then we're gonna take we have an ozone maker, so machine, and we fill up syringes with it, and then we infuse your blood with this ozone. And then we give that infused blood back to you. And this is great. Ozone's been around for like 150 years in the medical field. People use it for sterilizing instruments, for like wound care, way back in the Civil War when they were just learning about bacteria and things like that, infections. And so they figured out like, oh, ozone can help with this. And so then they really started ramping up like, oh, well, I can infuse blood. Some people infuse their water. And then there's a new type of ozone that you can do. It's called prolozone, where you can inject it directly into an affected area. So the benefits we're getting from ozone are any type of infection, fungal, viral, bacterial. Those things can be eliminated with ozone because of how ozone reacts in your body. And then also is a great treatment for inflammation, which is why I do it. I've got this bad foot that just from years and years of abuse and me not taking care of myself, being crazy, hurting myself.
You know what? Justin, thank you for
I
I appreciate you admitting that because I'm having like a little ankle issue. I went to a concert venue and stepped a little weird. It wasn't bad, but I was like, a little tweaky there. It's a little nagging pain. So last night I'm playing football in a parking lot. Bad idea. And it's 3-second hold, and I'm just about to go down. I'm holding somebody. I almost got to 3 seconds, and I feel like we're both falling over. I'm like, I'm not falling over on that ankle. So
Yeah.
I fall over there.
Oh no.
It's all good. It
Let's
doesn't
go
even
for
hurt.
the elbow, new injury.
Yeah, right. But I think it was better than, the ankle.
Yeah.
But so I'm like, in my mind, I'm like, getting old, got an ankle issue, but I'm happy, but not to hear,
Yeah.
that we have them. We all have these little things going on, but a lot of it, I'm sure, is because we don't have proper nutrients and we're not servicing or nourishing, replenishing our body with the right kind of stuff. So the IV therapy just makes the most sense. How does
Yeah.
somebody find you? Best way to go to the website?
Yeah, so you can go right to our website, just ketamineclinicofnwa.com. That's in our emails on there, ivketamine of nwa@gmail.com. So that's the best way to contact us. Or you can just give us a phone call, 479-318-2382. You'll talk to our amazing front desk person, Shay, who's just phenomenal with patients. Everyone talks about her, and they never talk about me, but they definitely always talk about her, how great she is. She's just wonderful. And then you can set up an appointment. You can ask questions. She's so knowledgeable about everything we do in this clinic.
Fantastic. So Lowell, Arkansas is located where? What's the biggest city?
It's Rogers, Bentonville, Fayetteville,
Fayetteville.
It's this cluster. Fayetteville, where the university is, Bentonville, where Walmart is. Like it's this metropolitan area. We're just a little tiny city that's right next to Rogers. Like they share, you can walk
Gotcha.
from one end to the other.
Both of you guys, thank you so much for spreading the word. Always had so many questions about ketamine. Finally got to answer them, and I feel that way for everybody on the planet because you can see this anywhere. But certainly, if you're anywhere near Lowell, Arkansas, definitely game changer with your health. Why not even just make the call? Just ask questions.
That's the best thing to do.
Appreciate it. Thank you so much for being here today.
Thank you.
Thank you.
Thank you. We'll be right back.
Are you looking for even more of the podcasts and hosts that you love? The Podcast Business News Network is proud to announce that you now have even more ways to listen live. Check out the MyTuner Radio, online radio box, and Simple Radio apps on iOS and Android, or find us online. Search for Business News Network on mytuner-radio.com, or search Podcast Business News Network on streama.com and onlineradiobox.com/US. Take your podcast on the go and don't miss a minute of the action.
Broadcasting from the business capital of the world, this is the Podcast Business News Network.
For nearly 2,000 severely injured veterans, everyday life has become filled with barriers.
Day-to-day simple tasks can become pretty daunting.
I have to carry my chair up 2 flights of steps or have somebody do it for me.
What scares me the most is just the falling.
When I'm struggling with my house, I think, to have that one great barrier just knocked down, it's crucial.
Home for Our Troops is a wonderful nonprofit that builds a
Mortgage-free, fully adaptive, handicap-accessible house. And there's no catch.
It'll be our very first home that we've ever owned.
This is a game changer.
This is where your life begins again.
We need you to join us in completing this important mission. Please visit hfotusa.org and help build homes and rebuild lives.
Because of you, everything's going to be okay.